Hey guys, what's happening? So this video is made to help supplement the accessory ossicle video as well as act as a short introduction to radiographs. I'm definitely not a pro when it comes to radiographs, but to help answer some anatomy questions I got from this section, it came to my attention that with little knowledge of radiographs and seeing something in your notes like this, or in a sense, how is the laterally located bone seen most easily with something called medial anything? So let's do a quick crash course of some basics in radiographic imaging while adding to what you already know from anatomy. And just to make things even better, I got some help from a friend of mine.
In this section, we are going to cover 4 different radiographic views and go over the accessory ossicles discussed in anatomy. This may seem daunting at first, but we'll go step by step. Here is an image of each of the radiographs we're going to discuss. When you look at each of the radiographic images, it's important that you make note of what you can see most clearly from each view. The names of radiographs can get confusing, but the names of the radiographs tend to correlate with the anatomy that they focus on, so that will help you remember their names. Let's take a look at the anteroposterior, or AP radiograph, and the lateral radiograph. The AP radiograph is an image taken from the anterior aspect, or front of the foot, and directed posteriorly. Hence the name AP for anterior to posterior. As you can imagine, from this view we'll be able to get a good view of the top of the foot. Most accessory bones that can be viewed from a dorsal view can potentially be seen with the AP view. Notice how from this view we can see the plantar sesamoid of the hallux. The overlap of bones will appear brighter. And because of this, from an AP view, it can be hard to discern which bones lay on top of the foot and which one's more plantar. This takes us to our lateral view of the foot. Just like it sounds, it's an image taken from the lateral aspect of the foot. Although this image can help in determining which bones lay more dorsal or plantar, note how the transverse plane of the foot, or the view in which we see the most overlap in this image, completely obstructs our view of what's going on between the bones. The AP radiograph is better for showing what's going on between the bones, but the lateral view is more helpful for viewing these 2 accessory ossicles, os trigonum and os supratelare. The next 2 radiographic views we'll go over are the medial oblique, MO, and lateral oblique, LO views. As you'll find out, these 2 views make it easier to view certain parts of the foot that the AP or lateral views would not be so good at. It's important to note that, unlike the AP and lateral views, which are named based on the direction the image is being taken, the medial and lateral oblique images are named based on the position of the foot. In the medial oblique image, the foot is placed with the medial aspect resting on the ground and the rest of the foot lifted up in an oblique manner. In the lateral oblique image, the lateral aspect of the foot is placed on the ground with the more medial aspect open and visible. Keeping in mind how the foot is positioned while the image is being taken should easily allude to the result of the image. For example, if the medial aspect of the foot is squished to the ground, like in a medial oblique radiograph, then the lateral aspect of the foot is more visible. In this case, when thinking about accessory ossicles, any lateral accessory bones, especially those that may be crammed between 4th and 5th metatarsals, will be exposed. The same goes for our lateral oblique image. The lateral, or outside part of the foot, is squished, and the medial view is more exposed. In order to better learn and understand these 4 types of images, try thinking about what scenarios might call for a specific type of radiographic image.